Welcome to Lovesick, the podcast, where we dive into health, wellness, and relationships and their impact on the world. Come be a part of the discussion. Join our community by following us on YouTube, Instagram, and listening wherever you get your favorite podcasts. Enjoy the show. Welcome back to Lovesick Podcast. I am here with our usual host, Dorothea and Jada. And we have a special guest joining us once again, someone who probably needs no introduction, but who is the host of Ask Dr. Drew on Rumble. Dr. Drew, welcome to the show. Welcome back.
It's great to be here, guys. Thank you.
I know you're tired of me gushing over you, but every time I see you, it's like a mix of both my childhood and my professional life overlapping. And I just think to myself, what a wealth of information.
You know, it's so funny. I appreciate that, and I really do. But lately, there's something going on, something in the ethos, where people come up to me all the time and want to express their. I almost don't know what the emotion is, but they're longing for a love line to return. That's sort of how they describe it. Like, and I have to kind of reorient them and go, no. You really don't want the love line back because it just wouldn't work. You want the 90s back. That's really what you're looking for.
Yeah.
The 90s.
Yeah.
You want that back. You want us as we were 35 years old. You want us to have that show in 1997. Okay, I understand that, but that's different.
Yeah, if people felt a little more innocent, a little kinder, maybe. felt like we didn't know.
God. And no Google, right? And so nothing. And so people had lots of questions, and we were that was the naive idea we had, was just help people understand stuff that I would have wanted answered to when I was a kid.
Well, I think maybe people still want answers because they Google it and get it wrong now.
Well, so you're putting your finger on something very important, which is the information is all there, but the confusion is still there. Also a problem. It just has a different kind of quality to it.
Yeah, and to that end, I want to dive into a part that you were so gracious to be willing to come on and talk about. We want to talk about men's health. Men's prostate health is something that people do not discuss enough. This is an area that I think people overlook all the time. And you touched on it last time you were here, but we really thought it would be important to come back and kind of, since you're willing to share your journey, and there is so much bad information.
Oh, yeah. Oh, no, I'm an open book about it. So I work with something called the Prostate Cancer Foundation. You can go to their website, pcf.org. Tons of information if you're worried about a family member or you yourself have been diagnosed. We're the sort of center of the universe of all things prostate cancer. And I myself have prostate cancer. I was diagnosed about 2010. 14 years ago. And I went on something called, I was picked up early. So I went on something called active surveillance, which was at the time we were doing recurrent biopsies. And I did that for about 2 years, and then it was growing, so they felt they had to really do something. And by then I was ready. At the beginning, it's like, you're not ready. It's like really hard thing to, particularly at 50 or whatever I was. Yeah, I was 50. And I was like, oh man, my uncle had this, my dad had it. And so if it's in your first degree relatives like that, it's very likely it's going to happen to you. But they got it in their 70s. And I assume that's when I would get it. Then I'd get external beam radiation. It would be no big deal. When you get in your 50s, it's a different thing. And I can tell you more of my story from there. But the one thing that I have been gravely concerned about when it comes to prostate cancer are the populations. And the PCF is very much involved with this exact issue, there are populations that have more prostate cancer than average. And when they are diagnosed, the prostate cancer tends to be further along and more aggressive. And African-American men are definitely in that camp. And my patients, my Black male patients, do not want to deal with this problem. They don't want to hear about it. And I really rely on sisters and moms and other women in the family to help get the men to get it together with their treatment. Because there's no reason, no people should not be dying of prostate cancer today. It just shouldn't happen. We should be getting it early enough to deal with it, manage it, cure it, and there may be some follow-on whatevers, but deal with it. We have so much we can do now that letting it get away or diagnosing it at the time when it's too late is just heartbreaking to me.
Yeah, I agree. I couldn't agree more.
And I think, like, for women, when we have to test ourselves for, do our self breast exams, is there an equivalent to that for males to
No.
regularly check? No.
Nope. It's a completely occult thing, has no symptoms. It's a blood test. You got to start those blood tests at age 40 if you have a first-degree relative with prostate cancer, and age 50 for everybody else. And I think a lot of men believe that somehow there has to be a digital rectal exam involved with it, which there does not. We can do it all with blood tests now. But once the blood test is positive, then we have to get on this. And there's lots and lots to be done. And because we're getting better at surveying and picking it up and imaging it, we're getting it early. We're getting it very early. And oftentimes it's just surveillance. Oftentimes it doesn't require treatment. So it's nothing to be afraid of. And when it is treatment, I had a prostatectomy, a radical robotic complete prostatectomy, which back in the day meant you'd have erectile dysfunction and bladder leaking and all kinds of groovy things, of which I have exactly none. And it's interesting when I sat down with my surgeon and I said, all right, how many you done and what's the complication rate? He goes, well, I've done about 1,100 and so far 0. I went, okay, put me on the schedule. I can deal with that. 0 is just about right where I want to be. And I needed about 8 years later, my PSA kind of came back a little bit, so I had some radiation, and even that now has progressed. They have something called MRI-directed SBRT, which is this very localized radiation that has no side effects. I had 0 side effects from that either, and my PSA went back down to 0. So it's a good case in point of detecting it early, doing what you got to do, and then following up and then doing it again if you have to. And the thing gets really taken care of.
Well, I'm going to give you a huge compliment on my end, because after our last time you were here, I went and got my numbers tested because I was like, it's a blood test. I'm like,
there you go.
I'm a firm believer that these messages come to you when they're supposed to. And at first, the guy goes, oh, there might be something abnormal with you. And I was freaking out because my dad had prostate cancer. And he's like, no, you're good. He goes, somebody gave me the wrong one when I first looked.
Oh, no.
And I started laughing. But it actually was a blessing, right? Because it made me much more aware, and it made me like, you go through the steps. And I think one of the things that I want people to hear that you just touched on, I think the visual that most guys have is they'd rather not know because they think it's going to be the end of things that they love, or that it's going to be overwhelming. It's going to destroy their life. And the reality is you're living proof that this can be managed and everything can be fine.
Oh, that is the most of the experience of our prostate cancer patients today, is that it'll be fine. We'll take care of this. We'll do what we got to do, and you're going to be fine. And let's not minimize the threat of what an operation is to that region of our body as men. It's going at what it means to be a man. I get it. I understand that it's very threatening. And then just the word cancer. I mean, when you get that word for the first time, it's really an interesting experience. You feel like you're going to fall through the floor. It's so funny. And my thing was like, really, at 50? God, 20? 50? It's not fair. And I was not ready for an operation at first. And again, prostate's a very slow-moving cancer. And I sort of said to myself, I got all this stuff going on. I'll do it in the end of the spring. And by then, I got a really fine group. I got involved with the Prostate Cancer Foundation, and they had some more conservative measures to do. I ended up with the operation. And it was great. And it was really a zero problem thing, and continues to be. And I come across lots of men that put it off, delay it, don't do what they need to do. And it's just, then you are going to get into trouble. Then the need for treatment is, then you're looking at, maybe more radiation and maybe hormone blocking medicine and things that, you don't want to get into that, trust me. And if you get it early, none of that is necessary.
Yeah, it's options, right? The earlier you catch it, the more the options are. If you wait, the longer you wait, the less the options.
Well, the more the interventions are unpleasant, frankly, and who needs it? Why? Look, we can keep you, we can prevent that cancer from spreading and curing and hurting you, but who wants to be, a bunch of meds and things? It's just forget it. I don't want to do that. Yeah, I actually announced anyway. So I really don't want to do that stuff myself. I told my urologist, I'm like, if we get there, we're gonna have to talk about this because I want to consider some other ways of doing this. So
I have a question.
Yeah.
Can you actually live without a prostate?
I'm here. I'm okay. I'm alive. I'm living. Mine is gone.
Okay.
They take the seminal vesicles. They take the prostate. But they leave the blood supply and they leave the nerve to the penis, and the challenge and what the robot has sort of improved our capacity to do is to preserve those nerves so they're not stretched or injured in any way, and then the bladder, which the prostate penetrates to get to the outside world. I'm sorry, the bladder penetrates the prostate to get to the outside world. That whole setup. The way hooking that back up is better than it used to be. So again, less leaking and those sorts of symptoms.
That's interesting.
What are the things that you wish people knew the most? What if somebody, especially somebody who's in their early 40s, right? What do you wish the average man would know?
Mm-hmm.
That prostate cancer, I think, is just behind breast cancer in terms of the most common cancers in the world. And if you are in a risk category, which I didn't mention the other risk category because I think they mostly know it, that group, which is Scandinavian men, particularly Norwegian and Icelandic men. They have much more prostate cancer, much more aggressive prostate cancer. And most people have relatives that have prostate cancer, so they're aware that they have to really, really stay on top of that. And then African-American men, that's the other population that I worry like hell about. We're not doing great. I keep saying the NBA should be doing, there should be groups. We got to do stuff where reach out and get to this because the level of awareness is just isn't there. And you said, Jada, you mentioned doing self-examination of the breast and stuff. As men, we are horrific about going to the doctor. All men. You guys get used to going in your teen years, for screening and whatnot. Mm-hmm. We got nothing like that. We don't start going to the doctor until way later in life. And usually the first time we go is because our spouse or family member drags our ass in there. It's not, we're not going on our own very often.
Or there's a problem that's been around for a while because usually right away men don't go. Men go, let me give this a while and see if it gets better, or maybe after a while. It usually takes a spouse or a partner or a loved one who turns to you and goes, it's time. It's been time.
Yeah, no, listen, the women in the room are looking at you going, oh, it's so dumb. Because I know how you guys feel about it. It's like, really? You're really that dumb? But yeah, we really are. Yeah. And literally all of us think that way. All of us. We all go, if it's going to, let it kill me because I really don't want to know. You know what I mean? If it's going to kill me, it's going to kill me anyway, so fine. I'll just die.
I will vouch for this. Away. This is the truth.
I mean, it happens with everything. No, we talk about that a lot where it's like literally, this still hurts after like 5 weeks. I guess maybe I'll check it out.
Maybe. That's a maybe.
That is true. I mean, even with women, we go through a lot with different tests that we have to get. And I literally just came back from my mammogram just before I did this.
Well done.
So I just actually had that done before I came to the studio. And we just made a joke about it, saying, get it smashed. That's what I said to her. Yeah. But it's important.
By the way, if men had to go through that miserable experience,
no way.
You do a much poorer job than women do. I swear to God.
Hey, it's hard enough to get us to go. If there was anything like that for men, medicine would go out of business if that were the case.
Think about the fact, here's why we don't go get our prostate screened, is because we still have a memory of the fact that they used to do a digital rectal exam. Therefore, we're not going to get the blood test.
Right.
Yeah. They want to do something to me.
Yeah.
Not that you're definitely going to get a part of your body smashed miserably.
And for women, we take that as that's a normal, this is, you put it on your calendar and it's a normal thing.
Yeah.
And women show up. Like, that's also a compliment to the way women just kind of endure pain in society in a different way, because they just show up. Because men would be like, I got to cancel that. I have another option. Is there another place I can go? Hey, it's been lovely. Hey, doctor, you guys are really busy that day. You have more important cases. Like, anything to get out of it.
Yeah.
I wish it were just funny.
Right.
Unfortunately, it's not. You're
true.
right.
It's accurate. It's true. And that's what we're fighting here, right? And so we have to make it trendy or something. I don't know what we do. I've been thinking about this for a while and I've not succeeded. And the best I've gotten to is to reach women in the various communities to get them to really work on their family members.
Right.
But even that, I mean, you guys are busy doing other stuff. You can't just worry about the men's health in your life.
And we're stubborn. It's hard to drag us, even if you can get to us. So,
oh my God, this is an ancillary topic, but the same exact issue pertains to erectile dysfunction, and the problem there is that men aren't aware that erectile dysfunction is often one of the earliest signs of heart disease. And so they don't come in for that. And we don't get a chance to screen them because they don't show up unless their spouse or whoever drags them in.
Wow.
Oh, I didn't know that.
Is there, just for the research side of it, is there like a known cause or any type of cure that's coming for prostate cancer?
Well, prostate cancer, it has not ever changed. It's a cancer that's been around forever, the same as it is now. It's not increasing or decreasing, particularly that I'm aware of. Anyway, I don't think so. But the medical relationship with prostate cancer has evolved dramatically over the years. When I was in training, prostate cancer was this sort of sleepy cancer that oncologists didn't even involve themselves with because it either was this slow-growing tumor that you lived with, it didn't bother you, you died of something else, or it killed you quickly and there was nothing we could really do about it. And that was it. And so you either had one kind or the other, and we kind of did radiation and whatnot for the slow version, and the fast version, we kind of threw up our hands. And so you didn't hear much about it, and people that died of prostate cancer died of it, and people that did okay because of radiation therapy just did okay and needed, follow-up and whatnot. It was not something that we emphasized because we didn't have as much to do. Now we have cures, we have treatments, we have so much we can do, and people are living with this tumor dramatically longer than before. So there's a lot of people around with prostate cancer whom would have died before that you would have been hearing from. I'm probably, if it had been 40 years ago and I got prostate cancer at 50, they probably would have done external beam radiation and it probably would have come back. And then I wouldn't be here talking about it. So that's, I think, why you're hearing more about it.
Is there a world because when we go to the doctors, when you're like 40 or whatever, or a certain age, they're like, okay, it's time to start getting these mammograms when you go to your general practitioner. Is that the same when you're going to see a general practitioner? Are they like, it's time for you to see your urologist?
No, they kind of mention it, but goes back to the male thing, and tell me if you disagree with me. Dr. Drew is like, they kind of mention it in passing, or like, hey, we could add that to some blood work, but guys are very...
Okay, so is your doctor a family practitioner or an internist?
I've had both. So
okay, so there's a little controversy about how much to screen and how frequently and how soon, because there is a philosophy out there that people like me are screening too aggressively and therefore subjecting people to treatments that they maybe really don't need. This cancer wouldn't hurt them anyway, and it would have showed up later, and then we can deal with it later. I am not, that is not the deal. The numbers are clearly lining up to show that people like me are doing the right thing. But there are still people out there that want to be more conservative and say, I don't know, we'll start at 50 or maybe even 60 and we'll screen you. But as you get towards 50 and 60, you will get a PSA every year. That is routine screening as you get older. Younger, it's controversial whether we should be screening or not a little bit. And you also asked about treatment. I mean, there's so many amazing treatments coming. You know, the enzalutamide was a big breakthrough in treatment of the metastatic prostate cancer. But what's about to happen, when I saw this technology, I thought, oh, that's going to be the thing. But cancer is very smart. We have been really deep into the genomics of prostate cancer now, and so we're breaking down all the specific genetic mechanisms and what makes certain cancers grow and do their thing, and how many different kinds of cancers there are within prostate cancer. There's many, many hundreds, I would say. But there is a marker. So with the blood test that you get, that we've been talking about, it's called the PSA, the prostate-specific antigen. And there's even a more specific protein that is expressed only on prostate cancer cells called PSMA. And PSMA, we have figured out ways to direct imaging to that protein. So literally we can send little radioactive particles to the single protein and image the protein cells, the prostate cells, wherever they might be in the body. So we can detect these tiny, tiny presence of prostate cancer outside of the prostate, should it have gotten there. The other thing, and also we can direct radiation at it and other things and detect it way before it would have been visible before. But the more extraordinary thing, and this is the really interesting thing, is that we can essentially take radioactive particles and attach it to that prostate cell and instruct the cell to take it in, so we destroy every single cell. So every single prostate cell can get attacked by a radioactive particle that has, by the way, it's so low radiation dosage that it only kills the cell. It has no effect on the surrounding tissue. The problem is that prostate cancer is so damn smart, it learns how to downregulate the PSMA or to not take it in the way we want it to. It learns how to survive the attack we put upon it. So much like bacteria, which you act the same way, and much like other cancers, we have to figure out a way to attack it in multiple angles simultaneously so it doesn't genetically alter itself to create a mechanism to undo our attack. It's interesting, right?
Wow.
It's fascinating. Look, nature finds a way, right? Even the bad sides of nature. And this is one of the things about medicine is we constantly have to innovate. Because the body, the thing that is attacking you is going to find its own way to fight back. And, it's kind of a biological warfare that's happening inside our body all the time.
Exactly right. It's exactly right. Once that tumor decides it's a tumor, it wants to survive. Even though the crazy thing is it destroys the whole system. It's a weird glitch. But yeah, that's, and same with bacterium. They want to survive and they find ways and they share information. They have plasmids that go back and forth, and there's all kinds of, and tumors do the same thing. They find ways of sharing information. So it's so, to me, it's breathtaking to watch biology at work. It's just so incredible. It's so, and this is one of the things I worry about when we talk about nutrition and things like that. Everything sounds like a story, this happens, then this happens, and it just is not how it works. Yeah. It's like trying to tell a story of how a cloud's going to behave. It's just kind of all happening all at once, and there's a probability of something going a certain direction, and you want to, understand the thermodynamic effect of those probabilities so you can understand what's happening and maybe go at it.
Yeah, always changing, always evolving, right? Always finding new ways. I think it's the thing about biology that's fascinating, and it's one of the reasons I read medical studies. As strange as it sounds from time to time, they look at me like, "When did you read that?" But I'm obsessed.
I don't think there's anything wrong with that.
I think it's fascinating. You also touched on something from a personal advocate side.
Yeah.
You talked about how you're a rarity from the standpoint of people say that you're asking for too much screening. I don't know how you could ever screen or find cancer too early. I lean towards your side. I think we overestimate, especially when it's a blood test, right?
Well, I'm sympathetic to that point of view. That's why you notice I didn't attack it.
Right.
Because I'm by my nature somewhat conservative in my way I practice. I mean, I really feel that doctors don't pay enough attention to our mandate, which is do no harm, right? And unless we can prove that by screening early, we are not doing harm, we are only doing good, or at least disproportionately doing good with the outcomes. There is evidence that we're doing too much radiation, a little too much surgery, a little bit too much this and that. Now, I would argue that was days gone by, and we're still sort of adulterated by that literature from 10 years ago. But I'm sympathetic. I get it. Do no harm is a very serious thing. And that's why I would warn you, too, when you read medical literature, make sure you read broadly, because things go back and forth, and then you'll kind of see a consensus developing. That's the biology, the cloud thing happening. You can't say things are all one. That's why I'm so pissed at the press for reporting things in medical literature as though that's it. Thus saith the Lord. Here's the answer, as research shows. No, research doesn't show anything.
Yeah, it's not a fact.
Produced 50 times.
Yeah, it's not a fact.
Maybe it's showing something. So, yeah, it drives me crazy.
I know every time, but everybody wants to be the authority.
Yeah.
And we do a disservice to everyone when we start acting as if all of these things are universal, because there are no 100% medical universals, right?
No.
The body is adjusting, you're adjusting, the environmental factors are changing, biology is changing, things are fighting. You know, it's never that cut and dry.
Well, it's why we have residencies and clinical training in medical school, because the biology and all the science stuff is all crammed into our head by the end of the second year of medical school, for the most part. What we do after that is the application. So we have the experiential learning of seeing how it manifests in human systems and developing judgment, not knowledge so much as judgment, so we can make the right call for the right patient with the right condition in the right context with the right medicine, the right dose, because it's our judgment that that's the right thing to do, not because there's some algorithm telling us to do it.
Dr. Drew, I want to ask about the insurance companies. What major part do they play in this decision making of why it's too much radiology or too much of this test or too much of that test, and then they won't pay for it?
Yuck. So,
I hit a nerve on that one.
Yeah. So I've been dealing with insurance companies my whole career, and it's been so frustrating and so problematic and so disheartening. And then a new layer has been added to that, which is now most physicians are employees of big hospital system and things like that. So they have bosses who are sending down what used to be called clinical pathways, which are algorithms. Exactly what I said we shouldn't be doing. And then the insurance company goes, aha, the hospital has an algorithm. Well, that's what we're going to cover. We'll only cover the algorithm that you, Dorothea, must fit into because that's just the way we decided. There's nothing special about you. There's nothing special about your doctor and his or her judgment about you. You're just another algorithm. That is horrific. That is the opposite of the practice of medicine. That is how we get into trouble. That is where medicine is right now. And it's gravely, gravely concerning. So I would say the most important thing, two most important things, is make sure you have a physician that gives a damn about you and is well-trained and cares and is willing to work with you to fight things when they come up, and be ready to advocate on your own behalf.
Wow, that's some good information.
I think that's what we talk about too, why some people just don't even get checked out because of like insurance, or will it cover it, or I don't have the right insurance. And so maybe it's going to be too expensive, and this is why I don't go.
And unfortunately, Jada, the fear of cost keeps people away from the medical system. And so let's just think about it this way. For somebody if a Medicare or Medicare Medi-Cal patient to see me costs them nothing, first of all, but I get paid about $47. And if they don't come to see me or don't follow up with me and get sick and end up in an urgent situation and walk either into an urgent care or an ER, Just walking in the door is $2,500 because you have to pay for all that staff and infrastructure and equipment that they have to contend with. I've got my office and my office staff, and Medicare controls everything we can and can't charge. It can be, and with telehealth these days, can be done very cost effectively. People just need to do a little bit of homework and not be so scared that because you're going to end up in the ER. And then it is $2,500, or maybe, God forbid, a lot more. And it's completely unnecessary, completely.
Yeah, and you really need to do some research and find doctors who you hit the nail on the head for me is care.
Definitely.
Yeah.
Because there should be a personal relationship. This is one of the ideas of having a regular doctor and seeing them regularly is someone who cares about you.
That's being taken out of the system.
Yeah.
That's being removed from the system. I'm telling you, that's what I've been fighting my whole career. For fine physicians that have the opportunity to care about you, meaning they have the time and they are allowed to, it's really hard. And by the way, you're about to enter, we are quickly entering a phase in medicine where you are not going to see a physician. You're going to see, it's just not going to happen. You're going to see either a nurse practitioner or a physician assistant. And for most things, that's not bad, right? I don't know, I'm not being critical of it, but you got to be prepared for that.
I'm seeing a lot more of that actually.
Yeah, when you go
It
in.
is,
doctors,
and because they do the cost analysis on it, right?
Yeah.
And this is, they can charge this much for the PA, they can charge this much for a physician, they can charge this much for the nurse practitioner. And so they start doing the math and they're like, well, and the only, like, there are places where it's good because you can see somebody quick sometimes and there's access. Some aspects of it could be beconsciential.
A lot of it is. Let's be fair. Common things happen commonly, right?
Yeah.
And nurse practitioners, physician assistants are well-trained. They're conscientious. I've seen some remarkable ones. But you just got to, you kind of understand it. I got involved with an organization called the Wellness Company, TWC, because we are using telehealth and getting these kits in people's hands. I feel like we need to go directly to patients and give them medications and education and things to do on their own. I mean, you know how to use Zithromax, right? I mean, do you have to pay $300 to go see somebody and pay for the fine? Look, you can get a telehealth visit for $30 and or a handbook, some education and the medication, and I can trust you to do the right thing. I do it all the time when patients travel. I put together a travel kit for this company. I give them stuff for infectious diarrheas. I give them stuff for skin infections. I give them stuff for sort of head and neck stuff. And I give them anti-nauseals. I give them anti-seasickness. And guess what? There's never been a problem. They've never been inappropriate with using these medications.
Right. Wow.
Really cool.
I mean, I guess I'm fortunate still to have physicians that I actually see face to face for now anyway.
What part of the country is that?
Well, we're in California, but we're in Long Beach. But a lot of my physicians are in the Huntington Beach and the Newport Beach area. And right now, they're all collaborating as a team to, which hopefully they can stay that way to make sure that each physician knows what's happening with me.
That's good. And listen, when people get sick and have specialized needs, like I don't want to discourage people from that. I mean, my care has been exceptional, right? I went to UCLA for a lot of what I got. City of Hope is great. Hogue is great down in Newport. And there are
that's me.
That's right.
Yeah.
Okay.
That's me. Yeah. Yeah.
No, I know lots of good physicians down there.
Yeah.
And there's still things seem to be functioning, but the powers that be it's hard to keep the system operating the way it should operate. I'm fearful it's going to split into two systems. I think that's what's going to happen because people are going to get so frustrated with physicians being owned by systems and insurance companies and moneyed interest. They're just going to split off. I just see that happening.
And it's sad because going back to what you were saying about how things might change in the future, which I'm sure it will, but it was sad that I had to go through my insurance company to make sure that every physician that I'm seen by is actually on that list where I can keep that doctor.
Yeah.
Because that was important to me.
That is the new world order.
Yeah,
That's the good part of the story, that you can do that.
Yeah. So I'm happy I could do that. Yeah.
Yeah, exactly. And
I didn't have to change.
But now imagine you don't speak English, or you're very elderly, or you have a little dementia, or it's just, oh my God. For those people, I dealt with a case last week. And it was in Orange County. And I was like, oh my God, somebody has to take this woman by the hand. And I described to the doctor what I felt she needed, and I was right, because it's not going to happen unless somebody does this. And we just, oh my God, we do a terrible job at that right now. And that never used to happen.
Right. Yeah, we're losing a lot of that. I volunteer in a hospital, and I work with kids and babies, and it's fascinating too, because like in that example, the patient a lot of times can't tell you, and then you add in a family member who may speak a foreign language. We have translating machines and things, but things are getting lost back and forth. Yeah, the system is hard enough. When you have all these other factors, it gets really
by the
confusing.
Way, we're so proud of ourselves for addressing the bilingual issues, but there's bicultural issues that make in the way of it. So, and if you've really tuned into what it means to say somebody needs, I don't know, some following interventions, you'll miss it entirely. What's going to help get them to the care?
Yeah, I mean, we've had cases with babies where culturally, especially the older people in the family, have not wanted some of the interventions that were necessary.
Oh, of course.
And they couldn't translate or explain to them what it was or why, and it delayed care. And
listen, I have stuff on the other end of the life spectrum where there are particularly some Asian cultures where they will continue to keep people alive on machines to a ridiculous extent. That is, that's not just only abusive to the patient on the machines, but just actually absurd. And their position is, but there's a heartbeat, so you have to keep going. It's like, but
wow, yeah,
okay, that's what I have to do, but it's not good for anybody.
Wow, I guess you don't think about that, but that would be kind of selfish.
Or it's the opposite, where you're just basically a number, not that patient, and it's just more of like, let me get you in and out, and then. That care is gone too. I'm not speaking up loud enough. Sorry.
There you are. Now I got you.
I was being told that I was not speaking loud enough.
Going back, Dr. Drew, what are some of the symptoms for a person who may be experiencing symptoms early of prostate cancer, and then also for the loved ones who may have to get them to go? What are some of the first early signs that people usually miss?
If you are having symptoms, it's late. All right. So if you are having changes in your urine, so your prostate, there's lots of symptoms associated with the prostate: decreased stream, urgency, getting up in the middle of the night, not being able to hold your urine very long. That's all part of having an older prostate. Some of that could be associated with prostate cancer, though typically not. Typically, there are no symptoms. And if it's getting out of the prostate capsule and eroding into the nerves and whatnot, and it causing erectile dysfunction and things, again, you're on, that's advanced. That's advanced. The symptoms that you need to look out for are family members with prostate cancer. That's if you have, first degree relatives with prostate cancer, you must get on this. It's highly likely it's going to happen to you. Just a matter of when, and we'll hope it's as late as possible. And we need to, when it happens, or if it happens, we need to be on top of it. What's happened to me, I'll tell you, my story was kind of interesting. My wife felt that I was complaining of feeling sick too often. And then I got H1N1. And H1N1, I don't know if you're aware, we had a pandemic 10, 12 years ago. It was H1N1. And it killed 300,000 people, and it was brutal. That was a terrible illness. I had both Alpha or Delta COVID and H1N1, and I would take the COVID any day. Wow. H1N1 was a brutal illness. And when I finally recovered that, my wife went, well, that's not normal. Something's wrong with you. And I was like, what? I've got a cardiologist. I've got a pulmonologist. This was H1N1. What are you going to do? It's just bad. It was a bad illness. No, you need a general internist, which I did not have at the time. And I was, going to see my subspecialty friends. It's a good case in point for having a generalist. And she made an appointment for a physical. And I was like, oh, okay. Again, this is the male thing, right? Go, here it is. Well, until she made the appointment, I didn't make the appointment. I just dutifully went. And this is how dumb we are as men, even when we're doctors. It doesn't matter. And okay, everything's fine. I don't know what she's talking about, but your PSA went from 1 to 4. Okay, 4 is still normal. But the rate of acceleration within a year of going from 1 to 4 was a tiny bit odd. And I said, yeah, I agree with you. I'll tell you what, I'll come back in 6 months. We'll do it again. No big deal. And my physician went, no, I think you ought to see a urologist. I go, listen, don't get anxious because we're here. I was like, you relate too strongly to me. Maybe you're identifying too strongly. I'll come back in 6 months. Don't worry. And he's like, no, go see a urologist. Okay, I'll go
look at that smart psychologist and look at the male version of us come out, right? Hey, come on, slow down.
Yeah, and I really, so it gets worse. So I go to the urologist and he goes, yeah, this is probably a nothing. Let's give you some anti-inflammatories and some antibiotics and we'll recheck it. It doesn't go down. He goes, well, let's do that again because this is almost undoubtedly nothing. And doesn't come down. He goes, well, you need a biopsy. And I'm like, you see, if because of being so aggressive, I'm going to get a damn prostate biopsy and nothing's going to be there. You know? And I'm ratting on everybody, ragging on everyone. Like, gosh darn, I'm getting unnecessary procedures. This is why, by the way, sympathetic to people that are sort of physicians that are reluctant to check the PSA too early because you're doing procedures and procedures are dangerous and whatnot. I get the procedure, prostate cancer. So I had egg on my face. I would apologize to everybody and announce that everyone has excellent judgment and was able to use that excellent judgment to my advantage. And it's a great case in point that that's really what you want the doctor to do is use their judgment. In spite of me going, no, come on. Their judgment was, it doesn't feel right to me. Let's move on. And to be fair to me, when I finally got to the Prostate Cancer Foundation and the urologic team over at Cedars and UCLA, they went, yeah, you're here kind of early. This was early detection, awfully early. That's why we went into active surveillance. But had I not been in active surveillance, I would have been in trouble because that tumor started to grow. And we saw it grow. And even though the grade was low, the location was weird and the rate of growth was weird. And anything weird, it's time to move. And that's what we did. So
and did you thank your wife?
Oh, yeah. Oh, 100%. 100%. Listen, I have no trouble apologizing or calling myself out for being ridiculous or dumb when I am one of those two things or both, as in this case.
That's me too. I'm like, that was me. I'm sorry. That was my bad.
Yeah. Yeah, I like apologizing. That's how you learn.
100%.
So how do you feel now? After everything. Yeah. How do you feel now?
100%.
Good.
Maybe even a little better because I started paying more attention to my health and doing proper screening and follow up with an internist and things. And I'm getting, more appropriately involved in health and fitness and paying attention to aging. I'm better. I would actually say I'm better than I was then. I'm 15 years older, which is not fun. God, I'm maybe more. I have to count the dates. But yeah, 65 is a thing. Let me assure you.
I know. I know, Dr. Drew. I know.
I hear you. Preach.
Well, that's my question is, okay, so what are those things that you wish you'd started sooner? Like, that's what I want to know. What are the things I should be attacking or adding to my repertoire?
I wish I'd kept my weight down more. I wish I'd cut out alcohol more.
Oh, no.
I wish I'd started. I have a couple of supplements that I really swear by. One is nicotinamide riboside, which right now the best manufacturer that, in my opinion, is something called True Niagen. And it's clear to me that there's very few supplements that I can point at and go, that for sure is doing something. And I'm convinced of the science of that in terms of reducing oxidative damage to cells, which should reduce rate of aging. and help the immune system and whatnot. The other is something called fatty 15. These are both things I have, by the way, I've been an actual paid promoter for, but before I was actually using their products. And fatty 15 is a new supplement called pentadecanoic acid. Turns out we're deficient in this fatty acid. And the fatty acid deficiency leads to a bunch of other oxidative damage. This brilliant veterinarian found this in dolphins and started looking at illnesses in dolphins and figuring out why they had them, what deficiencies they had, replacing it. And this was something they found was protective, and they're now developing similar findings in humans. And then the other thing I take, I was thinking about this morning, is just DHEA, which is kind of a testosterone booster. And I've been on that for certainly the NR and the DHEA for years and years and years. And I feel like, years and years, 15 years, and I feel like that has helped.
Can you elaborate on the alcohol? Because you said you wish you had, not drank so much. Can you tell us why?
I like wine, and I always thought, I am not an alcoholic, and I don't have an alcohol problem. What's the big deal if I drink, 4 or 5 glasses of wine a week or something, or 2 glasses of wine, whatever it is.
Right.
I recently cut it out entirely about 4 months ago, and I'm seeing a difference in my cognitive function. I thought, wow, is that what that? And my sleep too. Mm-hmm. And I'm like, oh goodness, you got to pay attention as you get older. Am I going to never expose myself to alcohol again? No, I'll probably drink a little bit here and there again. But damn, I am seeing the benefits of abstaining from that. And I think that's more about aging brain than if I were 30 or something. But definitely at 50, 60, you got to start thinking about that.
So how much is too much, though, daily? In your opinion, how much is too much?
I was for a long time drinking 3 to 4 glasses a week. And then towards the end there was more like 6 glasses a week maybe. And so I'm going from 6 to nothing and noticing a difference. So 6 is too much. I'm certainly 1 is no big deal, right? That's no big deal, I would say. But again, we don't know. Depends on the individual. For a lot of people, maybe it's nothing. And maybe it's just that it disrupts my sleep. And that's what I'm noticing. My sleep is better. Therefore, I'm clearer cognitively. I don't know.
Yeah.
It's just that the brain, the aging brain is a little more delicate. Just like my shoulders are messed up too. I don't like that either. Can we complain about some other stuff? Got the rheumatism in my back.
Hey, we'll give you support for any of it. And any solutions you have, we take them. We take advice.
And listen, I am not into bumming. I want people to live.
Right.
That's important to me. I want you to live and live fully. But if you're trying to optimize health and stuff, there might be ways to, look at these things.
Maybe that's why I can't sleep good at night. The wine.
It does it to me, man.
You might want to try it.
Wake me up middle of the night.
Yeah.
And then carbohydrates, they are, and process. These are enemies. The carbohydrates are not good for us. Not that no carbohydrates, but you got to pay attention and cycle them and make sure you're, it's just exactly what everyone's always told you. Fresh fruits and vegetables, especially the vegetables, get lots of protein and grass-fed finished beef and wild-caught fish. And these are optimal.
Right.
This is optimal. Do you have to be perfect? No, I don't believe in being perfect because it's hard to live that way. And I want people to live and enjoy themselves.
You have to live. I think that's one of the things is we're trying to optimize health. And I think that's great because the more we optimize our health, the better, and the longevity is great. But you have to live in the process.
Yeah.
Completely.
Otherwise, you miss life.
Right.
Oh my God! When I look at that guy, there's that tech guy that's living under essentially a glass dome, being studied by doctors every day, and just dedicating his life to he's already dead as far as I'm concerned.
Yeah. He turned himself into a lab rat, right?
Yeah.
Like he's giving away the life that. And especially you have all these resources, you could be doing so many amazing things.
Yeah, right.
And I do understand that there may be value for others in looking at what he did, but I don't want to live in a bubble.
Right.
No.
Life is
by the way,
supposed to be messy.
There's lots of risk in life well beyond, just controlling our metabolic circumstances. There's a lot that can happen to us. And you don't live under the bed. Don't shelter in place. When the mayor of Los Angeles kept saying that every night, I just thought it was the most destructive thing you could possibly say, particularly to an adolescent.
Yeah.
Shelter in place. Oh my God. if I were 14, hearing that if I didn't shelter in place, I was going to kill my family, I would never get over it.
Yeah.
And I think we have a whole population that may never get over it. Thank you, Mayor.
Can you actually send that message out to the men again, especially the African American men, of pushing them to let them know how important this is
Yeah.
to get, seen by a doctor?
Okay. I'm gonna go at it from several ways.
Okay.
One is you have more health risk genetically and more serious outcome than the average person, both when it comes to hypertension and the consequences of hypertension and prostate cancer. And I want you to come to me. I want you to come young. I want you to come. We'll make it easy. We'll make it quick. It's just a blood test, no big deal. If you do have hypertension, we have loads of great medication that cost nickels and have no side effects. And it's no big deal to do these things, and just get on it. If there, God forbid, is something there, we will take care of it. We'll take care of it early. And even when it's a nuisance, like having to have a surgery for it, believe me, it will be fine. It will be fine. Then the other way I would go at this is by saying, will you listen to your sisters and your wives and your mom, your grandma? Will you listen to them? Will you freaking listen to them? They're trying to help you. And that applies to all. That, by the way, that applies to all men.
Yes, all the time, all the time. Just listen.
Just the women they're good at this. They have good instincts. They know how to do this. Just follow. Just listen. Just do what they tell you. It's very simple. It's not that big a deal.
Your life will be easier. I'll say it. Life's better. Life's easier.
And easier and better. It's better. That's the other thing. It's not our brain. Our brain does not ask for directions, and we wait for something to kill us before we take care of it. Neither of those things are good.
Right.
Yeah, just enjoy. You'll get to the place where you get to enjoy it faster if you'll just listen and eliminate some of the
thing is,
potholes.
It is something you have to get used to. Listen, I've been a doctor for 40 years, but I've only been a patient, really cooperative patient for 10. And it's once you get used to it, it's really easy to incorporate it in your life. It's really easy. It feels like, I don't know, I think we have a fantasy it's going to take over or something, and it's going to, like really diminish us in some way. No, it's just like going to the gym. It's okay. It's fine. No
you just said a really key word. You said you have been a cooperative person. How important is that? I mean, patience, excuse me. How important is that for patients to follow directions once they've diagnosed with something, and then the physician tells them what to do and how to manage themselves?
That's a really important place. Because people are not trusting the medical profession right now, and I understand that. At its core, you've just made the case for why you should have somebody you trust that you can go to and communicate with, and you have a relationship with. If that's not possible, or if you haven't done that, no harm, no foul getting a second opinion. Always get more opinions. Any doctor that actually is concerned, actually wants you to get good health care, will be delighted with your being motivated to get other opinions. But once the opinions start coming, don't think you know better. You know what I mean? You really, I don't know how to say this without. I do want you to do your own research, but realize that, if you're hearing something you don't like, it's not because somebody's hiding something from you or there's some magical thing out there. That's, I could see how people could do that. But otherwise, it's just pay attention, follow what they do, keep it simple, do what they tell you, find somebody you trust, and just follow through. It's very simple.
Fair enough.
As we come towards the end of our time with you today, first, I just want to thank you. I think this is so important, and your openness provides a place for other people to be open, because I think this is an area that we've joked about, but if men don't talk about it, it literally is going to kill you or kill someone you love. And so I think it was so important for that. You have been a physician for so long.
Yeah.
You've been a public figure for so long. Now you've been an active patient for a period. You have a lifetime of wisdom. What are the kind of...
I'm afraid of whatever's going to come out of your mouth next.
I know. That was quite a lead
I'm
up.
holding my breath.
No pressure.
But what are some of these things as you've come to this place in your life, Dr. Drew? People have grown up and literally trusted you, and you probably can reach them in a way other people can't.
Oh,
so,
yeah.
So truthfully, what are some of the things you want people to take that you would give them if you were giving them advice as Dr. Drew, the person, not necessarily the patient or the doctor?
So let's see if I can get it all into a nice little sandwich here. When the great epics are written, whether it's Homer or Gilgamesh, whatever, it's always the same conclusion, which is, yes, you go on these great adventures, and yes, you try to fight the good fight, but ultimately you must come home, and as Candide said, and as Voltaire said in Candide, you must cultivate your own garden. Gilgamesh comes back and serves his community. Homer comes back and takes care of his family. It's always get back to the people you care about and love and your community, and expand that. I would say that there's richness in it. Maybe not just being your family of origin. Maybe there being other kinds of communities you develop, but serve others, serve your community, make a difference for somebody, and making a difference. While I like people doing things on a large scale, the real satisfaction that people get from making a difference is something that you have in you that you can offer to one other person, that you can serve and pay homage to that person. I'll tell you a quick story. The DJ AM, Adam Goldstein, he died a long time ago. He used to go around with Travis Barker, and they had a band together, and they got in a plane accident, and he got burned, and he developed severe panic flying after that, and he was a terrible drug addict. But in his recovery, which was before the plane accident, I used to send people to him for sponsorship because he was such a great sponsor, and his recovery was so solid. But he eventually, he eventually relapsed. Long story. But the reason I bring him up is he was on my radio show one day, and I said, "Damn, I like those. Are great shoes." And he goes, "You like them? I will get you a pair." And it hit me in the core of my abdomen. I was embarrassed and ashamed. Like, no, don't. He goes, no, I can see you really like these. I'm going to get you a pair. And he identified something in me I didn't even identify myself. Yes, I really did like those shoes. No, please don't do it. God damn it. Next day, he came back with a pair of those shoes and said, I want to offer this to you. This is my service for today. And it took my breath away, that the level of selflessness that went into that. And I was like, I'm so humbled by this. And he said, don't even think about it. Being of service to you is what keeps me sober today.
Wow.
I was like, wow, that service, that kind of service, if you can approximate anything like that on a one-on-one level, you're going to benefit, the other person's going to benefit. And that kind of service, simple service, really goes a long, long, long way. So be of service, pay homage to others, be present. I'm going to add another layer to this that I don't often add, which is that the echoes of our past. I'm dealing with some stuff right now, which I thought I had dealt with in therapy years ago. And I'm like, damn, it's still there. The echoes of our past come around, whether it's trauma or how we related to our family of origin. And we really need to pay attention and try to heal it again in these interpersonal opportunities, in the context of our interpersonal experience. And ultimately, the human experience is about the other. It is about those, we are social animals, and being present with others is what's necessary. And then beyond that, it's how we age and age well, and do the best we can, take care of ourselves. And there's a whole other topic we can get into in that. But keep your muscle mass up so you don't lose. Your resistance training is important. Keep your weight down and lift weight.
Well, that means you'll come back again, right, for another topic.
I'll come back to talk about aging and that kind of stuff. But it gets complicated, when you really start talking about what I can offer, because human experience is complicated. We're complicated animals, but the more we stay close to others that matter, the sort of better we are.
All right. I asked that really heavy question, and I got everything I hoped for and more, Dr.
Great.
Drew.
Yes.
Wonderful.
So if I would say one thing is, I'm sending you a hug for this journey that you're on, for whatever you get through, because we're all growing through processes that we have to return to at times.
Right.
All of us. Yeah, absolutely. Me
That's
too.
true.
Everybody. And if,
Yeah.
if you think differently, then there may be some more serious problems.
Yeah. And life will teach you some very valuable, tough lessons.
Yeah.
Yes.
Yeah.
Well,
There you
So
go.
thank you
thank
so
you
much.
so much. We really appreciate your time
Yes.
again, and
Always.
it's always a
Good to see you
pleasure. And
guys.
I hope we have some people who can take away from this
Right.
podcast today, like what
Cool.
Even one
Well, let's get
person,
on-
one person that goes
Right.
and get that blood test for the prostate.
That's right. Get the man in your life into the doctor, or at least just get the blood test. You can probably
Right.
just get it with a phone call and go get it.
Right.
so easy.
Thank you.
Thanks,
Thank you, guys.
Dr. Drew.
Thank you, Dr.
Continue
Drew.
blessings, and we love having you on the show, and
Thank you so much.
continue being on the show with us if you can.
All right. you
Have a
got it.
great day.
Thank you.
And say hello to your wife, because she's actually another important piece of this whole topic.
Yes.
Oh, we should go deep into that next
Yeah,
time.
exactly.
The reason I'm alive.
Yeah.
We would love to do
Yeah.
that.
Would love to do that. Let's get on the women now.
Maybe I'll bring her in. So let her
Oh,
talk for
yes.
herself.
That would be
Yeah.
great.
Yeah.
Yeah.
Right.
All right.
All right.
then.
Thank you so
All
much.
Thanks,
Thank
Dr.
you guys,
Drew.
and thank you for tuning
Bye-bye.
in to the Lovesick podcast.
Bye.
Bye.